Hi. For those who have recently joined my community since the time of my last video, about 364 members, I welcome you all to my community. It's a growing community and a community which deals with hair loss, baldness, especially related to androgenetic alopecia and all that goes into the treatment of androgenetic alopecia. So you must be wondering, what is a hair transplant surgeon doing with a thing like this, a boomerang? Well, a boomerang was a weapon used by the Aboriginals in Australia to hunt prey. It had the unique capability of, when thrown, to return back to the originator. And this term, boomerang, has found a place in English phraseology. Boomerang today means an act or an utterance that backfires on the originator. But today we are discussing about the use of finasteride in hair transplant. Well, how does a boomerang, a weapon of offense, fit into a hair transplant? Well, many a times a doctor, an experienced doctor, or an experienced clinic, to be more exact, because a doctor being bound by the Hippocratic Oath would rarely say that. But many clinics today are telling patients that doctors who are advising finasteride for their hair loss, finasteride for their hair transplant, are doing so because they cannot give results. And most of the patients who are not well researched get carried away. But eventually, this information, this misinformation, does boomerang upon the doctor or the clinic. But then you would say that this is a weapon which was meant originally to return back to the person who fired it. It was intended to do that. But this intention is not inherent in the field of hair transplant. Because which clinic would want that patient to return back the patient who has a poor result? Well, in many cases, it is intended to boomerang. Why intended? Because many patients are advised a hair transplant when the baldness is not stable. A hair transplant without finasteride. There are clinics today which do not care because they're mostly franchise clinics. They are not run by doctors. And they would like the patient to return back. They would like the patient to boomerang back into their practice. And that's an intended act. So either way, this is misinformation, and either way, it is not to the benefit of the patient. So getting back to the advice of hair transplant without finasteride. Are there any indications in which you can get a hair transplant without finasteride? Well, there are. There are 5 indications in which a hair transplant can be done without using finasteride. One is when the patient's baldness is absolutely stable. You can attempt to do a hair transplant without finasteride and keep the patient under your watch. Secondly, there are certain conditions like sick pattern traction alopecia or plain and simple traction alopecia, often seen in afro-textured women. And then there are patients who only require a body hair transplant. For instance, facial hair restoration. For instance, just adding density on the scalp, where already a hair transplant has been done. So in these cases, since body hair is resistant to DHT, you don't have to put the patient on finasteride. Finasteride is also many times not required in patients who are above 35-40 years. Because the testosterone level, the DHT level, the susceptibility to DHT of the androgen receptors is much less. And lastly, in those patients who have side effects but don't have too extensive a baldness, in these cases, one can attempt a hair transplant without finasteride. But majority of the patients who are young, who have progressive, aggressive baldness, will not be good candidates for hair transplant without finasteride. Finasteride, as I have discussed in earlier videos, when given in appropriate measure, after due consultation, counseling, getting to know the patient, is a very safe drug. Well, I have rarely ever seen a patient having erectile dysfunction with this drug. Getting a hair transplant done without finasteride, especially in patients who are young, who have progressive aggressive baldness, and there are signs of extensive baldness coming in the future, is just like a type 1 diabetic wishing to be cured of diabetes and denying insulin. We need to realize that androgenetic alopecia is a genetic problem. It is not an illness. It is not a bacterial or viral infection that it will pass off in a week or 10 days, that we require the use of finasteride for a few days and then we can stop. The activity of DHT on your hair follicles is always there. This gene does not go to sleep. It may hibernate for a while, but it is active most of the time. So if you intend to get a hair transplant done without the use of finasteride, you can in some instances, but please discuss it with your doctor. So thank you for watching my video again. And if you have any question, any query in your mind about hair loss, hair medication, hair transplant, I'm here to help you. But kindly please do not take opinions from me in a case which has been done by another doctor, because this is unethical. It is unethical practice for a medical doctor to interfere in another doctor's practice. And also, please do not mention trade names of drugs. Generic names only should be mentioned, because this is a no-profit community, and let's keep it that way. And thank you for watching, and God bless you.